and we're going to start our second panel. So, our second panel is integrating planetary health into healthcare education and practice, a multidisciplinary perspective. I have to inform you that we were supposed to have a very precious speaker, Dr. Eva Maria Schwinhorst-Stich, who was one of our keynote speakers from Germany and the leader of Sophia Project. But unfortunately, because of her sickness and some other problems, we are not having her with us. So I would like to ask Professor August Stitch, or sorry, Stitch, sorry for mispronunciation, to be here with us. So he's a professor of infectious diseases and tropical medicine at the University Hospital Würzburg in Germany. So that would be a great honor to have you with us. I know that you're widely known for researches in this area. So the panel and the floor is all yours.
Yeah, I hope you can hear me. And
Yes, clearly.
I want to thank you deep-heartedly, because the honor is actually on my side. I'm really very privileged to be able to talk to you. I've never been in your place. I would love to come. I would love to meet you all. And I think you are, especially as midwives, in a unique position. I mean, you are dealing with women in extreme situations, giving birth. You consult them. You are confronted with even sensitive matters like women's rights, and you are dealing with newborn babies on their most dangerous day of their life. Most people die on the first day of their life. So you are in really special situations. And therefore, I think the obligations you have to meet up with the challenges of your job are very, very high. And if I have the honor to accompany you for a few minutes now, I feel really privileged. So thank you for inviting me. And I apologize for the turmoil in the beginning, and especially also to the absence of my wife. She's in bed downstairs and really not in a position to talk to you at the very moment, but she will recover, I'm sure. So I will take over a bit of her task as well. And I try to share my presentation with you, hoping you can see it. Infectious diseases, a threat in planetary health. We all went through the COVID-19 pandemic. It affected every country in the world, more or less, and it affected many many people, and we had an excess mortality during the time of the pandemic. And I remember that we were all staring at this new virus, not really knowing what we have to expect. And one of the first graphs we saw at the beginning of the pandemic 4 years ago were these two bubbles. One was the rising incidence of cases, and the other was the healthcare system and its capacity to cope with it. And we said, well, we'll be happy when this is all over. And during the pandemic and even now, we were overlooking the fact that we had major challenges coming from behind at a much higher dimension as the pandemic has ever been. So assumptions. Many people think, and in my country we have a very strong right-wing movement which is opposing to the idea that climate change is man-made and happening actually. And some people say infections are no longer important, people are dying of other causes, infections can be managed, we have antibiotics, and climate change happens all the time. Let us carry on with our business. So all this is wrong, and COVID-19 and other infectious agents prove it to us all the time. So let's go through these assumptions and test them with a more or less scientific approach. Now, what is wrong on this hypothesis, infections are not important. Let's go back to the area 150 years ago when infectious diseases were unraveled, when the first bacteria and later viruses and parasites and fungi were detected. Louis Pasteur said, Messieurs, ce sont les microbes qui auront le dernier mot. Gentlemen, the microbes will have the last word. What we see is that the more countries move towards industrialization, towards development, the mortality of infectious causes is going down, whereas non-communicable diseases like heart conditions, like chronic pulmonary diseases, like cancer, like diabetes, raise in incidence. And this is happening also especially in your country. So it has something to do with human development, and we can perhaps challenge also the whether this kind of development is only a good one. But what we are seeing is a change in human behavior, change in nutrition, and this gives rise to diseases of so-called civilization, like, for example, diabetes. In the 60s of the last century, the chief advisor of the American president said, it's time to close the book on infectious diseases and declare the war on pestilence won. Well, we know this is not true. We have numerous examples that we are still fighting against serious infectious diseases. This is a picture I took during the Ebola outbreak in the Democratic Republic of Congo. I've also been to the West African outbreak several times. So Ebola, when it happens, is really a very, very serious threat to the individual patient with a high mortality, but also to the population and to the civil life. But we do not care in Europe, in Germany, if we have 1,000 cases in Africa. People are not really concerned as long as the problem is far away. But this is one of the major misconceptions in infectious diseases. They are all interlinked. The infectious agents do not respect geographical or political borders. Therefore, once one case is in Europe and it happened, then the hysteria comes, the media jump on the topic, and everybody is major concerned. However, for example, looking at the United States, how many people died of Ebola? None. But how many people are dying each year of obesity, of tobacco abuse, of alcohol abuse? Hundreds of thousands. So we have to get the priorities right. And as I mentioned before, looking at infectious diseases also means having a high concern in pediatrics, being the newborns in the first 28 days of their life. Infections are a major cause of mortality, and later many childhood diseases are still to be overcome. But the general tendency is clear. The green bars are shrinking, which means communicable diseases. They are getting less important. Lower respiratory tract infections, neonatal conditions. I mean, we have tools to fight them. Not highly efficient, but we have possibilities, whereas the blue bars are getting more and more important. The non-communicable diseases like ischemic heart disease, stroke, chronic pulmonary disease, and others. Now, looking at the reality of how health is provided in the world, we have to step out of our own countries, looking at the conditions in the various countries, of course, but also adapting a global view. So we see infections are important and they are a cause of death, but they are linked to socio-economic conditions and the capacity of the health system. Infections can be managed, and we have antibiotics. well can we manage infections? Here again, this is a graph of the most dangerous disease, lower respiratory tract infections and their case fatality. And on the other side, you see socio-demographic index, the condition of development of various countries. And you see that there is a clear trend. I mean, this is known for years, but I think it's always good to remember that the fight against infectious diseases means fighting underdevelopment and also providing access to proper health care wherever you are in the world. Septicemia as a main cause of death. And again, you see that countries in sub-Saharan Africa or in the poor parts of Asia are affected most. And especially in those areas, we do not have the facilities to treat them. Septicemia means intensive care of whatever shape. And we know that intensive care units are very, very scarce, for example, in sub-Saharan Africa. So global mortality associated with bacteria, again, the African continent is affected the most. And if we look at the various bacteria, there are known agents like Staphylococcus, like Escherichia coli, like Streptococcus pneumoniae, and many, many others. But the real rising topic and the fact we have to prepare ourselves now and actually yesterday is the rise of antimicrobial resistance. This is one of the major topics of the future. And antimicrobial resistance is not only the result of misuse of antibiotics in intensive care units. This is actually the least part. It is more a problem of the general use of antibiotics in human medicine, overprescription, and a lack of knowledge on the real indication. But the main source is animal. So when you eat a chicken, they usually come from mass production, and mass production of animals means use of antibiotics and then rise of antimicrobial resistance, of resistant bacteria, which then spread to the human population. And this is happening in many, many places. I was in Africa very recently, in Tanzania, and the colleagues there provided data which were really shocking. We know it from my country, Germany, but to see that the same dreadful development of antimicrobial resistance is happening in Africa was really shocking. Now, there is a global threat of death, and this means that death due to antimicrobial resistance now supersede HIV, breast cancer, malaria, and other major causes of death, but they are not yet in our knowledge. And what we know is that the rise of antimicrobial resistance is closely linked also to climate change. Now, projections for the coming years show that we have to prepare ourselves for an excess mortality due to this phenomenon of antimicrobial resistance. I mentioned already pathogens. I mean, I'm coming from the infectious disease department, so I'm always interested in the names of those agents, the bacteria, Escherichia coli, Staphylococcus aureus, Klebsiella, and others. Here are affected areas, and the green bars represent sub-Saharan Africa, and again, there are the leading problems. Now, looking at special disease entities, we are facing a rise in tuberculosis. Again, it's the most dangerous infectious disease at the current moment. And it's not only pulmonary TB, which many of us have in mind, but we also see extrapulmonary TB like here peritoneal TB, abdominal TB, or lymph node tuberculosis. And again, the rise of drug-resistant tuberculosis is very high. I didn't come across data from your country, but I think the best for you is to just be aware that this is a problem which does not respect political or geographical borders. So it will also come to your places. So we have to prepare ourselves. We have to get the necessary tools, and these tools are not only on the curative side. Many, especially pharmaceutical companies, they say we need more research, we need development of new antibiotics. It is true partially, but what we should never neglect is the necessity of prevention. And for this, we need anti-infective stewardship. This means that we have to be much more aware than we are currently on the right indication, the right dosage, the right duration of treatment as soon as we touch antibiotics. And here we cannot translate guidelines from Europe into Farsi and apply them in your country because you have to do it yourself, knowing the local spectrum of diseases, the local bacteria, the local resistance spectrum. So we need on-the-ground data in order to build up an appropriate antibiotic or anti-infective stewardship for each place in the world. So the next question, climate change happens all the time. I have heard this in the morning news again. I usually hear morning news while I'm in the bathroom, and people from the right-wing party, they try to neglect the fact that climate change is happening. And it's quite dreadful because these are intelligent people, but they tell us lies for out of political opportunism. So WHO identified risk factors for the spread of infection. And if we go from bottom up, it's the exposure to antimicrobials. We have talked about antimicrobial resistance, animal-man contacts. The most dangerous diseases are zoonosis, meaning diseases of animals, which can then spread to the human population. Bad hygiene in developing countries, also as a result, for example, of migration, big issue now, for example, in Syria, globalization and climate change on the top. Now, you have a symposium on climate change, and you might know everything I'm going to tell you now. So I apologize if I repeat things which have already been covered or which will be covered in the later hours of your symposium. But I bring you one example of my country, which helps me to convince people here in Germany that the phenomenon is really happening. And we have the example of West Nile fever. West Nile fever is a viral disease of birds. And these birds are infected by mosquito bites. And the disease is spreading in the bird population. And occasionally there are spillovers to other hosts like people or like horses. And this, you know, it's the white stork. I think it breeds in Iran as well. But when I go out now to the riverside areas of Germany, I might be able to see storks now in December. This is a map of Germany showing the sightings of storks which have overwintered, which have spent the winter months in Germany. Traditionally, storks are migratory birds. They leave the country in September and they come back in April. And the stork population of Germany migrates through Turkey, Israel, to the plains of Eastern Africa, even to South Africa in wintertime. And they pass areas already here on the Balkan, but also later in Africa, which are infested with the West Nile virus. So every migratory bird has the high chance to contract West Nile fever on its travel and either die or be immune for the rest of the life. Now, if we have the situation that storks do no longer migrate, or a considerable part of the population stays in Germany because our winters are getting warmer, this is a problem for the skiing industry, for example. The people in the Alps complain that the tourists don't come anymore because there are not enough skiing possibilities. Imagine. But this is a result of the winters getting warmer, and that means that migratory birds change their behavior, and we have a rise in a non-immune bird population. Now, these are cases of West Nile fever in Europe in the last years until 2017, always a few cases in the summer months. This is the year 2018, and we had a sharp increase. And in this year, West Nile entered Central Europe. The cases now also flared up in Germany. So for the first time, a tropical viral disease has entered Central Europe. And the maps of today show that we have quite a cluster of cases in the eastern part of Germany, and West Nile virus is getting endemic in Germany. And this is a clear result of climate change. Why? Because the transmission depends on the outside temperature. Transmission is done by mosquitoes, and the replication of the virus in the mosquitoes is accelerated the warmer and more humid it gets. So there is a clear connection. And why is it getting warmer? It's because of us. It's because of our way we change the surface of the Earth. And the principle is so easy to understand, and it enrages me that many people just refuse to believe it. We have a sort of winter garden. We have an atmosphere filled up with emissions, which are man-made, and they let penetrate the solar light, but they reflect the radiation, and therefore it's getting warmer. We have global warming. And this global warming results in three logical phenomena. We have rising temperatures, it's getting warmer, and we can measure it. The year 2024 will most likely be the warmest year since we checked temperatures. Then we have more weather extremes, drought and heavy rains in rapid sequence. And because the polar caps are melting, we have rising sea levels. And these three phenomena, as logical as they are, result in medical phenomena. We have heat waves, and therefore we have an overmortality, especially of patients with cardiovascular diseases. Or we have an increased air pollution, which is a problem with people with chronic lung diseases, and the incidence of chronic obstructive pulmonary disease is rising. We have more allergies, we have more waterborne diseases, and we also have environmental refugees. Let's have a closer look at vector-borne diseases. This is the Aedes mosquito, the Asian tiger mosquito, after a blood meal, but whatever it might have transmitted is already done because the mosquito was already in action. So it's quite important to have a look at these mosquitoes and especially at the biology of the vector and the specifics of the pathogens we are talking about. So vectorial capacity and factors of disease transmission. Example, Aedes albopictus, the Asian tiger mosquito. Originally home in Southeast Asia, But the spread around the globe has something to do with old tires. And you know from your own experience that in the tires, you always have a sort of wet thing, which is enough as a breeding site for Aedes mosquitoes. And even if this dries out, the eggs remain viable. And as soon as there's rain again, then the eggs hatches and we have a new generation of mosquitoes. And with the worldwide trade of tires, the mosquito spread coming from East Asia to many parts in the tropics, but also to the Mediterranean. It started in the 90s of the last century, populations in Genoa in Italy, and then all over the Mediterranean coasts, and then eventually also as a result of rising temperatures in Switzerland and now in Germany. These are sightings of Aedes albopictus in Germany, and since last year, we also have it in my town where I am here in Würzburg. And if we look at other Aedes mosquitoes, there are other species as well, then we see that they are entering Central Europe. So the invasion of potent vectors is already taking place. And this year, 2024, was the year with the highest numbers of dengue cases all over the world. Brazil announced an emergency because they had millions of cases. And we in Germany saw already in July more cases than all the years before. So again, we have reached a record in imported dengue cases. So far, until now, we do not have a mosquito transmission of dengue in Germany, but we have it already in northern Italy, in southern France, and in Spain. So dengue and chikungunya and Zika and others will follow what West Nile has already done, entering new areas and being a global health threat. So neo-invasive species and increasing temperature and humidity, giving rise to an acceleration of viral replication, both work in the same direction that we will have to prepare for more cases. Now, if we tell this to people, sorry, kid, but thanks to my selfishness, which means our selfishness, what we have done in the past decades, you will face unspeakable suffering from climate change during your lifetime. Is there any good news? Yeah, I'll be dead by then. Yeah? It's a joke in a way, but it shows that the elder generation might not have the incentive to really work against the development. Patients or people, sorry, who are born now, and you are midwives. So the babies you give birth to, they will have a life expectancy of something like 80 years, and they will very much see what is happening, and they will see it earlier if we do not stop the current development. My specialty is tropical medicine, so I have to talk about malaria. You will excuse. This is the Anopheles mosquito, the vector of malaria, so a different kind of mosquito. And what we teach our medical students is the life cycle of the parasite in the human host. It is complicated enough. It affects the liver, it affects the red blood cells, and we can teach for hours on this. But what we usually do not mention to our students is what is happening in the mosquito. It is not like that the mosquito mechanically transmits malaria on its trunk. No, it is that it sucks up the parasite, and then the parasite develops in the mosquito, in the gut, and later in the salivary glands. And then the mosquito, after many days, gets infective. And this sporogonic cycle is the so-called extrinsic incubation time. And this is highly dependent on temperature and humidity. Now, one example from your neighboring country, Pakistan. The World Malaria Report of last year, it was recently published because WHO always publishes the World Malaria Report in the at the late end of the year. It gives the example of Pakistan, and we see an increase of malaria cases during the rainy season. Now, in the year 2022, there was a serious flooding, you might remember, has affected eastern parts of Iran as well. And as a result of the floods, malaria cases flared up at high numbers and remained at a much higher level. And the floods are certainly the result of the intensity of the floods, are a result of climate change. Floods have been there before, but intensity and frequency change. And I've seen similar situations just recently in Tanzania, for example, that the weather conditions are changing and the local population here, fishermen in Lake Victoria, they are really concerned because they say that the old rules do no longer apply. And if we think this further, it means that climate change will depress agricultural yields, and it might result in a situation that many parts of the world are becoming uninhabitable. Looking at the temperature curve of Africa shows the same trend as everywhere. Temperatures are rising. And this is especially important for the situation in Africa because Africa will be the continent with the highest population increase in the future. Why? It's not due to the so-called fertility rate of African women. It's because people are getting older. And if you have a growing population, a higher life expectancy of the population, you also have a growing population. But meaning that we have to face weather extremes and rising sea levels. This will be a question of life and death for people in Pakistan, in Bangladesh, in the Pacific, and elsewhere. So, planetary health is a new term since about 10 years. It evolved from infectious diseases, tropical medicine, but it is the example of interdisciplinary approaches. We need other disciplines as well. We cannot say, no single person can say, I am the expert in planetary health, I know everything, because we always need other disciplines. So we can only understand the situation and fight against problems together. So planetary health means the health of the human civilization and the natural systems on which it depends. We are facing planetary triple crisis, not only the climate change with all its consequences, but also the loss of biodiversity and the pollution. Pollution, for example, with plastic, meaning also degradation of oceans as a major source of life, and pollution of groundwater and so on. So scientists have defined tipping points, which means that in the development of a situation, there might be a point when the development is irreversible. And then another mechanism sets in and might drive things forward regardless what we do. And for example, here, the Amazon, this is a picture of Peru. The tipping points which are reached, which are defined, are about a 2-degree temperature increase. And do you want to know the current situation? This year, we have more than 1.2. So we are really heading for tipping points in many places of the world. So we are very close to a situation which might become unmanageable. Now, my major concern, and you are young people mostly, you are dealing with young people, you are dealing with young mothers. If we always have the message on our lips, it will get only worse. What kind of messengers are we? We are facing two alternatives. We can climb the wall and say, what can I do as a single person? Or it's already too late. So don't care about it anymore because we have crossed the bridge already. Denial, repression, resistance, doomsdayism, fatalism, solastalgia. So understandable reactions, but wrong reactions. We have to go forward because there might be a panoramic view at the end. So if we convey this message to our colleagues, to our families, to students, there is no future, then we are doing something terribly wrong. We have to find positive answers. Still, we have to alert people. And I feel reminded of an old experiment. If you put a toad into hot water, not boiling water, of course, but hot water, it will jump out immediately. But if you put it in cold water and heat it slowly, it will not find the right moment to escape and it will die. And this is a bit of an example how we as human global population are dealing with the challenge of global change, climate change. So we have knowledge, we have lots of scientific data, but we are not yet able to do the necessary actions. So we have to bridge between knowledge and action. And this means we have to transform our society, our systems. I give you a picture of a cricket game, and let's imagine that the playing people is what we call health. And the population wants to take part at this cricket game, wants to be healthy. Now, unfortunately, there are sick people and they need support. And that's what we are trained for. We are nurses, midwives, doctors, medical people. So that's our job. But let's have a closer look at what we are really doing. If we say, well, everybody has the same rights, everybody has to get the same kind of support, then we are ending up with an unjust system. The very sick, the very handicapped need more support than those who have only minor conditions. And the reality is very unjust. And it is a pain in the neck to see how, for example, also the new American administration is favoring this. What we are really in need of is equity on health, which means that those who need more also have the right to receive more. Equity on health is a very important cornerstone of global and planetary health. Now, there are success stories. Since the beginning of mankind, millions of years ago, people did not live as long as today. Today we have the longest life expectancy all over the world, not only in North America and Europe, but also, for example, in Africa. Africa is behind, but also the projections are that towards the year 2050, they will reach an average age of 70. These bubbles represent countries and the colors continents, and Asia is red here. And these bubbles should be animated so they move towards the right upper end because the life expectancy is expanding due to the increasing the economic development all over the world. But, and this is the message, it comes with a price. We can be proud of developments which we have achieved in the past, reduction of child mortality, of maternal mortality in your case, which is very considerable, and we can celebrate this. We haven't reached the point to be happy, but we also can acknowledge the successes. But these successes come with a price, and the price are increased CO2 emissions, ocean acidification, energy use, tropical forest loss, water use, fertilizer use, and so on. So we are heading towards a situation when we have 10 billion people. This will be the level at the end. And these 10 billion people have a right to have enough food, enough water, and we have to prepare our planet to provide this. Therefore, every one of us can do something. We can all act on the so-called micro level, the individual lifestyle. And we already have the three options of nutrition, of mobility, and of energy use. We can then go to the meso level, which means our working environment, the hospitals where we are working. We can try to improve things, to stimulate actions which provide better use of resources. And then, of course, we have to move towards the political level, the society, the world community. And you are people in the medical field, and do not underestimate the importance you have as opinion makers. So these are the Sustainable Development Goals and good health and well-being. These are actions, what we should do. And actually, if Maria's job would have been to tell you more about how teaching can be done and how it can be done successfully. And my main message is we have to teach positive messages. We have to show solutions. We have to encourage people and not tell them how things are getting worse and worse. And there's an old African proverb, which I like very much, and I close with this. If you are ambitious, if you want to achieve things faster, if you want to go fast, then you have to run alone. But it's all about you. But if you want to go far, and that's what we want as climate change activists, walk with others. We have to look for connections, for friends, for people who support us, and together we can really have a great impact. And this together also means that we are sitting here now around a screen and you around a table. And I feel, as I said before, honestly privileged to have the chance to give this talk to you and perhaps answer a few questions or at least go into dialogue with you. So thank you very much.
Thanks a lot for your informative lecture. We really enjoyed that. If you don't mind, I would like to ask you some questions. Can you hear me?
Yeah, yes, please. I was already preparing for the question.
Very good. So, first, I'm going to have a recap of your lecture and then I'm going to ask you some questions, please. So, you first addressed the wrong assumptions of infectious diseases and some misconceptions that, infectious diseases are vanishing, but it's not like that. We still have mortalities. And you also talked about some civilization associated diseases such as cardiovascular diseases that are the first rank of mortality these days.
Mm.
And your most important term that you talked about was antibiotic resistance, which has root in overprescription and lack of knowledge. And what you talked about was really, really, really important and interesting. was anti-infection stewardship, that we have to go to this way and plan for this stewardship. So if you don't mind, I'm going to ask my questions. So my question is, you mentioned some of diseases such as malaria and so on, and I want to know that based on your experience in Germany, what's your recommendation for us to, uh, you know, uh, confronting these diseases in our own country, such as malaria? I would
Mm,
really appreciate that you tell us about some actionable measures. Thanks.
yeah. Thank you very much. And do not consider me as the world expert who gives you all the advices. Um, let's think together. I think the first step is to acknowledge that climate change is happening and that we are confronted with a change of spectrum of diseases. It will not happen like an epidemic. Today everything is fine, tomorrow we are in the middle of a disaster. Um, it's a gradual development. And therefore, we have to prepare ourselves in the medical business for these changes. And this means also we have to introduce topics of planetary health urgently into medical education of medical students, of nurses, of midwives, of any profession, because we will see this change of spectrum. And the more we acknowledge that it's happening and the more we are prepared, the better we can face the situation. And then, of course, depending on what kind of challenges we are dealing with, we have to find specific measures. For example, we can fight malaria. We can, with impregnated bed nets, for example, we can fight Aedes mosquitoes by treating breeding sites. We can fight waterborne diseases by looking at water safety. So there are tools, but the first step, and I think this is something which we all, including the medical community in my country here in Germany, have to acknowledge and to learn. So you are part of this process by spreading the news that climate change is happening and that we have to get prepared.
Thanks a lot. So that's humble of you. Of course, you're an expert. There was also another question the chat box that I would like to ask you. Due to our geographical uh, features in our country, we've recently detected about 500 cases of dengue fever and also yellow fever in one of the provinces of Iran. We wanted to know that if there are any cases of these things in your country available or not.
If I may correct you, it was not yellow fever, but dengue fever and other mosquito-transmitted diseases. Fortunately, yellow fever has not yet entered Asia. Um, Aedes aegypti is not in Central Europe yet. It is in parts of the Black Sea coast and further south. So what we have in this country is mainly Aedes albopictus and other Aedes species like Japonicus, Sondaicus, and others. Aegypti is the classical yellow fever mosquito, and this is still far away. But this doesn't mean that we can now relax and say, well, it's far away. The contrary, we are seeing changes. And as you rightly say, even in Iran, dengue is spreading. And wait another 3, 5 years, and you will have more cases. Therefore, now is the time to realize something new is happening and to get prepared.
Thanks a lot for correcting me, and sorry for the mistake I unintendedly made. Thanks a lot again for your informative lecture. I would like to announce to our audience that we're going to have a 10-minute break. So let's have fun.
And I thank you very much for being part of this conference. And unfortunately, I have to leave now because I have another obligation. I have to catch a train and get to another conference. And I wish you much luck. And I feel very closely related to the topics of your talk. And we are part of a so-called world community. So all the best for all of you. Thank you.
Thanks a lot. We wish you luck in the other conference. Your presence here was really precious for us.
Thanks a lot, Dr. Ishtish, to accept my invitation. It was really, truly an honor to have you in this conference.
So in the break time, I'm going to present a clip made by our students with passion to show you and introduce you the departments, the educational departments of our school. I hope that you enjoy it. This is made with a lot of love and we like to present it here. Hi again, everyone. We're back. I hope that you're fresh and up. So, in the second panel, we're going to continue with Ms. Hassan Tabar. She's going to have a presentation of a mixed, as a shared research with Dr. Nasir Nikpema and with Ms. Nusha Saadat. First, I'm going to introduce Dr. Nasir Nikpema again for you. She's one of the members of the scientific committee. She's also associate professor, head of community health and geriatric nursing department, Tehran University of Medical Sciences, Iran. And again, I'm going to introduce Ms. Hassan Tabar to you. She has Master of Science in Midwifery, Tehran University of Medical Sciences, Master of Science in International Health, Diploma in International Public Health, Charité Medical University, Germany, and she was also our international coordinator. So let's go to their topic, integrating. Their topic is integrating climate change, sustainability, and planetary health into nursing and midwifery education, a scoping review of knowledge, attitudes, interventions, and curriculum strategies across diverse contexts. So over to you, Ms. Hassan Tabar, we're all ears.
Hello again. I'm here to present our joint research with Dr. Nasrin Nikpema, me and Yushapur Sawadat in Tehran University. Our topic is incorporating climate change, sustainability, and planetary health into nursing and midwifery education. It was a scoping review of knowledge, attitudes, intervention, and curriculum strategies across diverse settings. Introduction and background. The escalating effects of climate change pose profound challenges to human health, the environment, and healthcare systems globally. Nurses and midwives, as frontline healthcare professionals, play an important role in addressing these challenges through practice, advocacy, and education. Integrating climate change, sustainability, and planetary health into nursing and midwifery education is critical to equip professionals with the knowledge and skills to address the health impacts of environmental challenges. Although there is growing recognition of this need, significant variability exists in how these topics are incorporated into curricula worldwide. Understanding existing knowledge, attitudes, interventions, and strategies within nursing and midwifery education will help identify gaps and guide future efforts to embed these critical themes effectively. So, as we know, climate change is a very important topic in planetary health and is a very important issue in public health, especially that it affects our vulnerable population, and our healthcare professionals require some education in sustainable practices, climate resilience, and planetary health. We also acknowledge the role of nurses and midwives to address these climate change mitigation and adaptation strategies. This research is very significant because we would like to address a very urgent need. As the health impacts of climate change intensifies, nurses and midwives must be adequately prepared to respond to emerging challenges and promote sustainable healthcare practices. This topic also has a very significant global relevance. By mapping strategies and identifying gaps, this study will provide insights for educators, policymakers, and institutions to develop effective evidence-based curricula. Also promoting planetary health matters, integrating sustainability as a concept and education in climate change nurtures a generation of healthcare professionals who can advocate for planetary health and environmental stewardship in clinical practices. And overall, the most important item is to support equity. Understanding barriers in low and also high income settings, it's very important to address these challenges. So in this research, we also have addressed these global challenges and specific to Iran and region context. Our study objectives were to not only explore students' knowledge and awareness, but also to explore their perceptions and attitudes toward climate change, sustainability, and their relevance into nursing and midwifery practice. We also wanted to analyze educational interventions, like which educational interventions were effective, what kind of materials were used, what kind of strategies were used, and also how sustainable practices were discussed in nursing and midwifery, and what was the approach of these educational interventions. Very important topic that comes to climate change education in any setting is the psychological and behavioral outcomes, because the topic of climate change raises a lot of concerns and anxiety in students. And it's very important that we address these psychological aspects of climate change and planetary health education, being aware of them and knowing how to address them in our educations. We also had a section about cross-cultural comparisons, because we know that many educational interventions, knowledge and awareness raising are very specific to the context of the country. And lastly, identifying gaps in curriculum when it comes to nursing curricula and midwifery curricula related to planetary health. So about the study design. This was a scoping review, and it was following by a framework proposed by ICPHE. This scoping review had a approach to systematically map existing research on climate change, sustainability, and planetary health, integration into nursing and midwifery education, with a focus on identifying knowledge gaps, attitude, educational intervention, curriculum integration across diverse contexts. We have used different data sources to search our keywords. Our primary databases for this review were PubMed and Science Direct and Scopus. We also did a citation searching, and we have reviewed the Google Scholar to ensure that we have included any gray literature that matters in this area. Our keywords were a combination of our nursing education, planetary health, midwifery education, climate change and nursing curricula, and sustainability and nursing education. So our inclusion criteria were the studies published between 2015 to 2024 in English, focusing on nursing and midwifery education that were peer-reviewed. We have included studies that have different methodologies, such as quantitative, qualitative, or mixed methods. And our exclusion criteria were articles that didn't have the focus on nurses and midwives, because there were so many articles about medical education and based on medical students. But when it comes to nursing and midwifery, we should have another approach. Or they lacked focus on planetary health and sustainability. We used PICO framework to organize our thoughts at the beginning and take advantage of a methodological framework to ensure that this study has a clear focus. We know who are our population, patients, what is our intervention, who are our comparison group, and which outcomes we are searching. Our populations were nursing and midwifery students, educators, or professionals that are active in practice. Our intervention were educational interventions integrating climate change, sustainability, and planetary health principles into nursing and midwifery curricula. And in the articles, we saw a variety also of educational interventions. So we included articles that had scenario-based learnings, digital tools, a variety of tools and methods. Our comparisons were regional or institutes that did not integrate climate change or sustainability concept into their curricula. Also, the students without exposure to any educational interventions or awareness raising. And our outcomes were basically the research questions that we were looking for. How's the knowledge? How's the awareness? What is the understanding of climate change? What is the students' perception of sustainability? And also have these universities in the study integrate sustainability practices into nursing and midwifery. And we also looked for barriers and facilitators for effective curriculum integration. We used Prisma flowchart to ensure a rigorous methodology. So the initial data record that we found was 159 databases. And through a rigorous method, we screened about 587 records only with their title and abstract. 428 records were excluded. And then the records that were sought for retrieval, eventually 92 studies were assessed for eligibility. Some studies did not have relevance to education, to nursing and midwifery focus. And we had 3 studies that we excluded because of language barriers. Eventually, 19 studies were included in the study, and we reported the data of these 19 studies. We used a rigorous data extraction tool. We divided this tool to a study reference, citation, country, type of database, a study design, outcomes, cases, controls, sample size, sampling method, and year that the data was shared in the study. We also reported sampling methods, data collection tools, analyzing strategies. On the next level, we had a quality assessment, and this quality assessment tool was reviewed by 2 people. This tool was had 20 criteria, scoring each from 0 to 2 a scale, and a maximum point was 40. Key areas included study design, sample size justification, validated instruments, statistical methods, and ethical consideration. Evaluation of 19 studies on climate change and sustainability in nursing education showed high methodological standard, 85% to 90%, with strengths in objective design and instrument use. However, common weaknesses were inadequate sample size justification, non-response bias, and reliance on convenience sampling, limiting generalizability. We used NVivo 12 for data analysis, and we did thematic analysis using NVivo with the data that we extracted from the studies, which is a qualitative data analysis software. We use this software to make sure that we have a robust coding features, and we support a systematic and a structured analysis of our qualitative data. This approach facilitated the identification of key themes, patterns, and insights pertaining to climate change, planetary health in nursing and midwifery education. Additionally, descriptive statistics, including percentages and frequencies, were employed to quantify and summarize the distribution of specific themes and patterns across the data, providing a complementary perspective to the qualitative findings. So we have different steps in our schematic analysis. We started We started with data preparation and import. So key findings and extracted data from the 19 studies were uploaded into NVivo as individual cases. We assign attributes such as publication year, geographic region, and a study type were assigned each case to enable categorizing. And then we went to initial coding. A combination of manual and automatic coding was used to organize data. Relevant phrases and sentences from the studies were categorized under predefined themes aligned with the research objectives, such as knowledge and awareness, attitude and perceptions, educational interventions, barriers and facilitators, And then new codes were created to capture emerging themes and concepts not initially identified. After that, we had codes were grouped into broader categories or themes to reflect overreaching ideas. For instance, codes like knowledge of climate health impacts and understanding sustainability were considered on the knowledge and awareness theme. Code learning effectiveness and digital tool adaptation were integrated into educational interventions. And then lastly, we did schematic refinement. Themes were reviewed to ensure clarity, coherence, and distinctiveness. Overlapping or redundant themes were emerged or redefined. Representative quotations and key data points were selected to exemplify these themes and support the analysis. So now we go to characteristic of the study. Basically, we are moving to the section findings. We had studies that spanned 15 countries, and then geographical distribution of the studies were really wide range, including in Europe, United Kingdom, Germany, Spain, Sweden, Switzerland, and the Middle East, Saudi Arabia, Egypt, Turkey, Iraq, Palestine, Jordan, Northern America, United States, and Canada, and Australia. A significant number of studies focused on Middle Eastern and European countries, reflecting regional interests in sustainability and climate change in nursing education, which can be a lesson for our country. This picture is basically from our in vivo coding. The words that were frequently coming up were sustainability, nursing, climate change, and environment. So in each section, we had different findings when we thought about perception and attitudes. 75% of the students demonstrated positive attitudes towards sustainability, recognizing its relevance to professional responsibility and environmental advocacy. Only 30% felt prepared to integrate sustainability concept into practice. And due to systemic barrier like curriculum overload, limited faculty training, and institutional resistance. When it comes about measuring knowledge and awareness, 65 students recognized general climate contributors, but only 40% understood health specific impacts. Moderate knowledge levels with regional disparities were shown. Higher awareness in high-income countries due to supportive policies, while LMICs exhibited significant knowledge gaps. About educational intervention, scenario-based learning and educational interventions improved knowledge and attitudes by 20 to 30%, which is a significant number. Less than 50% of programs in low-middle income countries included planetary health topics due to limited resources, material, and infrastructure. Very important topic about psychological and behavioral outcomes. Awareness of climate change led to climate anxiety and moral distress among the students. Action-oriented, solution-focused education helped mitigate psychological impact and empower the students to take initiatives. So this is something to consider for our future educational courses, also in Tehran University. That when we talk about climate and planetary health, it may raise anxiety among our students, and we need to direct our educations toward being actionable, that students feel like empowered and feel that they can do some actions to mitigate or to adapt to climate change effects. About cross-cultural comparison, supportive national policy like Saudi Vision 2023 facilitated sustainability integrating in high-income countries. Low-middle-income countries faced pronounced barriers, including limited resources, materials, fundings. So we need interdisciplinary collaboration and alignment with broader policies, which were key facilitators in overcoming challenges. And which gaps existed in curriculum? Systematic barrier included curriculum overload, and I discussed the gaps later in our discussion. About the knowledge and awareness. As I said, we had moderate awareness of climate change and its health impact, with higher knowledge in high-income countries like Germany and Saudi Arabia due to supportive policies, while in low-middle income countries like Egypt and Jordan, we had significant gaps. Academic progression influenced awareness, emphasizing the need for early integration of climate change topics in nursing curricula to address foundational gaps. Attitudes and perception of climate change, it was positive of especially the teachings, but yet unrealized. Students expressed positive attitudes towards sustainability, viewing it as a professional responsibility and recognizing their role as advocates for environmental health. However, systematic barriers and regional factors such as curriculum overload and local healthcare priorities hinder actionable behaviors. And it highlights the need for tailored educational approach to address these challenges. Next slide. Effectiveness of educational intervention. When it comes to educational intervention, there were a variety of educational interventions applied, like scenario-based learning, workshop, digital tools, which improved the students' knowledge and attitudes by 20 to 30%. With so However, inconsistent implementation, especially in resource-limited setting, underscores the need for global collaboration and resource sharing to ensure equitable access to quality education. And now about barriers and facilitators to curriculum integration. The integration of climate change and sustainability topics into nursing curricula is hindered by barriers, such as curriculum overload, faculty resistance due to insufficient training and resource constraint in low-middle income countries. Facilitators, on the other hand, include supportive national policies, high student interest, interdisciplinary collaborations that we also discussed in previous panels. We can also adapt this strategy in Tehran University of Medical Science to have joint collaborative efforts with Public Health Institute, and also partnership with public health organization, which is a lesson for us. About cross-cultural and geographic differences, significant disparities in climate change education exist. As I explained, we have high-income countries benefiting from a lot of resources, very well structured, established policies, while low-middle income countries face systematic challenges which are shaped not only by resource constraint, but also by cultural and geographical factors. Global efforts such as the toolkit projects, which we also had in the Sophia project, we also shared this toolbox with our students in Tehran University, highlight the need for standardizing curricula and fostering cross-national collaborators. And lastly, about psychological outcomes and sustainability behaviors. Awareness of climate change led to a mixed psychological outcomes, with some students adopting sustainable behaviors, while others experience climate anxiety and distress. So we have to be mindful that action-focused education, leadership training, and fostering agency are essential to mitigating and addressing this overcoming institutional barriers. So what is the implications for policy and practice from this study? The lesson is that we need to integrate planetary health concepts across all levels of nursing and midwifery curricula, not only for our continued education, but also for our bachelor's, for our masters in different topics and different expertise. And we have to start early in a student's academic journey. We cannot just address our PhD and master's student. Another lesson is to provide targeted faculty training and resources to overcome resistance and build educator confidence. So this aspect is very important because we saw that there was some faculty resistance in some studies. We need to talk to all our stakeholders to prepare them for this concept, to raise awareness. And then we need to work context specific. What is applicable in one context might not be applicable in another. We need to develop region-specific educational materials and strategies that address local environmental challenges. And then after all, we need to act interdisciplinary. And I was very happy and I was very proud to have two professors of public health today having discussions with us and having educations for us. It is very important to work together. So what is the conclusion? Is that we need to address planetary health education now. It is very urgent and we need to incorporate a lot of climate change talk, policy, advocacy into our education. We need to redirect our education to have actionable acts rather than just being in theory, rather than just having some lectures. We need to focus on what can we do and how our students play a role. We also need to address regional disparities and empower students with actionable solutions. What we need to do is to prioritize early curriculum integration, targeted faculty training, region-specific strategies to prepare ourselves for advancing sustainable health practice. Thank you.
Thanks a lot, dear Miss Hassan Tower. I enjoyed your lecture. You know, there were some points that I was really interested in. First, you talked about multidisciplinary approach, and I saw that in your team. You know, two of the members. I mean, one member was from midwifery school. I mean, midwifery department, and the other one was nursing. And that was really nice that you take it into practice. Just it's not just saying that. And the other part was your focus on curriculum. That's really important. As you said that you know, students have positive attitudes toward planetary health, but they still unrealize its importance. And I wanted to ask you, what have you done in your university uh for raising awareness? But I already know the answer, so I want to ask you, what happened in your workshop and what did you do to raise awareness about planetary health? I know that you had a workshop in Tom, so I would be really appreciate if you tell us about it more.
Thank you very much for your kind words. Yes, we tried to plan our educational session in a way that it does not only incorporate lectures. We had some talks, of course, for students to prepare and get more knowledgeable about the term planetary health. This term, when translated into Persian, raises some questions. It's not such an easy term to understand. So we talked a lot about it. What is planetary health? We started with talking about what is planetary health to us. And we started with students sharing their own ideas, what it means to them to have a safe planet, to have a green planet. And students came up with some talks. And then we directed that ideas of a student into our education in the next levels. We did not focus on only raising awareness, but we also incorporated active learning materials. We incorporated paintings and arts, which my colleague will explain later, to have this combination of emotions and because one very important aspect of planetary health education is to involve our emotions into the teaching. So students had painting, students had scenario learning. We created scenarios for our country specific context. We talked about air pollution. We talked how nurses and midwives can consult people. And overall, we had pre-test and post-test to ensure that students give us feedback, because we are also learning from students and their need. It's not a one-way road. It's very important to us to understand what our students need and what are their thoughts about planetary health.
So thanks a lot.